Many studies have found a relationship between fluoride and fluoride exposure and intelligence. So typically the relationship is somewhere on the order of a half a standard deviation drop in IQ in areas with higher levels of fluoridation, which is a profound effect on health and has profound implications. But there are also neuropsychiatric risks that have been raised, including things like attention deficit hyperactivity disorder, including things like problems with executive function and decision making and other behavioral problems in children. And so the typical criticism has been that these studies were in countries like China or India, where, say, the naturally occurring amounts of fluoride are much higher than what we have here in the United States. Well, it turns out that in fact that wasn't true. So in the last 5 or 6 years, there have been several studies that have been published. Dr. Mallon has actually published some of these studies in communities in Canada, also in the United States, where levels of fluoride are actually quite similar to the levels that we have here in this state and in this country. And these studies have actually found the same findings, that moms and children exposed to higher levels of fluoride have experienced adverse neurologic and neuropsychiatric effects. I mean, it's appalling, but it's actually been documented in multiple studies now. The information that we have now to continue adding fluoride to water systems in Florida, it is public health malpractice. And so we are issuing guidance to every community, every municipality, every county in Florida to stop adding fluoride to their community water systems. The main reason why individuals develop cavities and babies and children develop cavities in the first place is a really important issue, and it's something that we care about. But the answer to that issue is not systemic dosing of the population with a neurotoxic agent. That's just, we have to find better solutions.